Welcome to Nightingale View. This video is about the crash cart. So what are all the compartments out there and the drawers and which are all the needed equipments to be stacked in the crash cart. Now these two are called as a top shelf. So what are all the things should be there in the top shelf? So the first row of top shelf is consist of ambu bag and which need to have a mask of adult as well as the pediatric, then oxygen masks, then face mask, you have a clean gloves and the sterile gloves, surgical gloves we used to say, of the different sizes we used to keep. Regarding the second row, this is the top shelf first row and this is the second row. So the second row should consist of a 6 drugs. So namely AAA DFH. AAA DFH. About the A, the first one is a atropine, second one adrenaline, third one avil or otherwise called CPM, D stands for deriphyllin or ethiophylline we can say, and this is a furosemide otherwise called Lasix, then hydrocortisone injection. So these are all the 6 drugs will be stacked in the second row of the top shelf. So this is about the top shelf. About the table, so this is called table. The table should be kept empty in order to prepare the drugs. So for a preparation of a drug, always this table should be kept empty. So regarding the side bag, actually this trolley should have a side bag where we need to keep a Foley's catheter as well as the bogey. So Foley's catheter, you all know different sizes it will be available for male and female, and this is a bogey. So what is this bogey? So bogey is a catheter, flexible catheter, and it is made up of a silicone flexible catheter. So it is otherwise called intubation stillet also, and this will be used during the ET intubation in order to guide the ET tube correctly and to position the ET tube very correctly. So this is called bogey. So this bogies and Foley's catheters will be kept at the sides. In a crash cart, after this table we have a drawers. There are 6 drawers. When you face towards the crash cart, your right hand side will be a right drawers and left hand side will be a left drawers. So what are all the things has to be stacked in the drawers? There are top drawer, middle drawer and the lower drawer. This is of left side and this is the top drawer, middle drawer and lower drawer of the right side. So regarding this top left drawer, what are all the things should be there? Actually we used to have all the IV access equipment like a 3-way adapter, syringes, sterile water, IV cannulas, adhesives, then we have a disposable sterile cottons and all. Likewise we have all the IV access equipments in the top left drawer. So regarding the top right drawer, we have all the airway management equipment like ET tubes, then Goodell's airway of different sizes we used to have, then laryngoscope with all the blades. Extra batteries can be kept in the top right drawer. Then come to the middle left drawer. We used to keep a non-cardiac drugs, so which will be used for an antidote. So non-cardiac drugs will be kept over here in the middle drawer, and this drawer is for a cardiac drugs. And about the lower drawer, this drawer will be for miscellaneous things like a Bain circuit or circuits for extra things and all miscellaneous we used to keep here. And for the lower drawer of the right side, we used to keep a injection midazolam. So these are all the things has to be equipped in the drawer, 6 drawer. This is a left top drawer, middle and lower drawer. This is the right top drawer, right middle and the right lower drawer. So this is for IV access and equipments. This is for airway management. This middle drawer is for non-cardiac drugs and the cardiac drugs. and the lower drawer is for miscellaneous things on the left side, and right side we used to keep a injection midazolam. Apart from that, we have a lower shelf. That lower shelf is consist of all the dressing related equipments like a bins, gauze, Gamgee pad and all we can keep, along with the kidney tray as well as the IV fluids. So these are all the things has to be essentially to be stacked in the crash cart. Thank you.